impression materials I want to show you this afternoon is called polysulfide. It's not one that you have an exercise to work with, but the information is in your book about this material. Polysulfide is not used near as much anymore because it is a little bit messy to mix, and the newer materials are more sturdy, but you may see it still be used for a denture impression in a custom tray for that final impression. So in order to get ready to use the polysulfide, you can see hopefully that we have a base that is a larger tube, catalyst is a smaller tube. All right. Have a mixing pad. This is our spatula for impression materials, not for alginate. We also have an adhesive, and this adhesive is specific to our material that we're using. So the first thing you want to do is, after you've tried the custom tray in your patient's mouth, is paint some of this adhesive on the tray. This is a little bit thick, but you kind of get the general idea. We're going to be painting it all on the borders of the tray, all over the inside. We don't use this material very often, so I don't keep a stock of material that hasn't expired because we just really demonstrate it. But in order to make this a final impression, we're going to paint all the borders, extend the border or the adhesive over the border of the plate, the tray, so that when we put the impression material in there, it will adhere to the tray and not pull out of the tray when we get ready to take the impression. So use your imagination that adhesive is painted all over that tray and along the outside borders. The next thing we're going to do is measure our material, and this is equal lengths, not equal amounts. So for a custom tray, we're going to try to use probably about 6 inches times 2 for the base. And hopefully you can see that before it spreads, but the thickness of the layer of material that you string out is equal pretty much to the opening of the tube. When we do the catalyst, you'll notice that the catalyst tube opening is smaller. So I'm not going to try to do equal amounts. I'm doing equal lengths. If we had smell-o-vision, you would smell that this is a very fragrant impression material. The name of it's polysulfide, so it has some sulfur components to it. We're going to pick up the catalyst. Remember, we're always going to pick up the catalyst first. So use the side of our spatula and begin to just spread the base and the catalyst together. You're going to have to push a little bit hard. And your goal is to be able to keep, number one, keep all the impression material in the middle of the tray or middle of the pad. But what I want to do is also mix it until I don't see any more streaks of blue or white, that it's a homogeneous mix. So again, I'm scraping the pad, scraping all the material to the middle, and then mixing some more. You have a pretty lengthy working time with this material. I think it's all pretty good, but then when I pick up my spatula, pick it up on my spatula, well, it does look pretty good. A few little white streaks in there that we'll get out. So again, this material is designed to use as a denture impression, possibly. So I would get my prepared custom tray. Whoa. Load it from the posterior, just like we did alginate. Cover all the borders with the material. And then this will be placed in the patient's mouth. You have to hold this impression in place until it sets, and it takes about 5 minutes or so for this material to set. So you can see why we've kind of gotten away from using it, although it's a very, very accurate impression for edentulous patients. But we would use this as the final impression for in the steps of making our denture. And we'll talk more about dentures later.